Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. On today's video, we will continue with basic communications and commands on page 84 in the book. So if you have a copy of the book, I would tell you to turn there now. If you don't, let me suggest that you go to Amazon.com and purchase a copy of the book. It will make following along in the video with these series of videos much easier. The book was written in English in alphabetical order. So it may seem, if you don't see what I'm referencing, you don't have a reference point, that I'm all over the place. So one minute I may be talking about driving, and then next minute I'm talking about twisting, and then I'm going to, let's say, feeling dizzy. So you may not get the connection unless you have a copy of the book. But with that being said, vamos a empezar. On page 84, the first set of instructions, I would say, is to do not turn your feet inward. We know that patients that have posterior hip precautions are restricted from turning their feet inwards or their legs inward to protect their hip. So, to say that, no gire los pies hacia adentro. No gire los pies hacia adentro. I'll say it one more time. No gire los pies hacia adentro. The next one, and I did a video specifically for spinal precautions, and I will upload soon a video specifically for hip precautions. But this one is another one. Do not twist. No te tuerzas. No te tuerzas. No te tuerzas. The next one. Do not walk fast. No camines rápido. No camines rápido. No camines rápido. The next one, do not worry. No te preocupes. No te preocupes. No te preocupes. The next one is, do you drive a car regularly? So many times we would be asking patients this because we know therapy is not cookie cutter. Many of our patients go back to living their regular lives. Some have to make adjustments. So one of the things we need to find out is what was their prior level of function? What was it that they were doing before? Okay, so this one, manejas un coche regularmente? ¿Manejas un coche regularmente? ¿Manejas un coche regularmente? The next one, do you feel better? That's a question that we are asking almost every patient every day. Hopefully we get the answer, sí, or yes, but unfortunately that's not always the case. But to ask the question, ¿te sientes mejor? ¿Te sientes mejor? ¿Te sientes mejor? The next one, I want you to remember that in Spanish, every adjective has to match the noun. And with that being said, you either have to speak in a masculine or a feminine gender. So if we're speaking to someone masculine and they identify as masculine, or you're speaking to someone that identifies as feminine. So with this one, do you feel dizzy? ¿Te sientes mareado? That's for masculine. ¿Te sientes mareado? ¿Te sientes mareado? And for the feminine gender, ¿te sientes mareada? ¿Te sientes mareada? ¿Te sientes mareada? And the last one on this page, on page 84, do you feel nauseous? Do you feel nauseous? And that would be, ¿sientes náuseas? ¿Sientes náuseas? ¿Sientes náuseas? So I see that I'm at the 6 minute, so I think I have time to stick in do you know? The do you know is something that I recently started doing on these videos, where I'm just going to throw out a sentence or a command in Spanish and see if you understand, or see if you understand what I'm saying. Okay, that will be helpful. No gires los pies hacia adentro. ¿Sientes náuseas? No te tuerzas. ¿Te sientes mareado? ¿Te sientes mareada? No camines rápido. Manejas un coche regularmente. Manejas un coche regularmente. No te preocupes. So that's it for today's video. As I've said always, practice makes permanent. So práctica, práctica, práctica. As always, thank you for coming. Adios.